In healthcare, evidence-based practice is essential to achieving the quadruple aim, which is to enhance healthcare quality, improve patient outcomes, reduce healthcare costs, and empower clinicians. Implementing evidence-based practice improves patient safety and therefore should be the standard, but is not, as we have learned so far in our text from Melnick and Feinholz. Through continuing education and research, such as what we have experienced this semester, evidence based practice will continue to replace the historical way of providing care to a more empirical one that is backed by research. My name is Shushanova Dallas. Today I will be discussing my evidence based proposal project, Nurses' Impact on Medication Non Adherence through Standardized Medication Education Tools. This was prepared as a part of the University of Hartford's graduate nursing program course, Scholarly Inquiry in Nursing. Thank you for joining me today. Medication non-adherence is a huge problem in healthcare. How many times have you been taking care of a patient or their family and you said, "What medications are you currently taking?" And they said, "I'm not sure. I have the list here somewhere." Or how many times have you asked them, "Do you take your medications every single day?" And they say, "Sometimes, when I remember." Medication non-adherence affects up to 50% of our patients, and the impact is felt throughout the whole healthcare system. Medication non-adherence leads to worse health outcomes, increased rehospitalizations, and increased healthcare costs up to $290 billion annually in the US alone. So what is the cause for this problem, medication non-adherence? The answer to that is multifaceted. The studies show that there are several contributing factors to lead to this problem. There is a lack of staffing, there is a lack of healthcare literacy, there is language barriers and cultural differences, and also a lack of resources with access to medication and also access to education on medications. In completing the literature review for this topic, we found overall that studies support the use of education in improving medication adherence and improving healthcare literacy. One study by Bowen et al., Nurses' Attitudes and Behavior on Patient Medication Adherence, showed that nurses only spend about 5 to 9 minutes completing medication education during a hospitalized stay, and only 58% of nurses complete that education. Another article, Patient and Healthcare Provider Perspectives on Adherence with Antihypertensive Medication by Edward et al., showed strategies to improve medication adherence, such as improving cultural competence, including cultural leaders in the education process, using technology such as phone reminders to improve the adherence to medication, and addressing misinformation by, once again, using education and improving health literacy. Finally, another article that I reviewed is Empowerment, the Key to Promote Adherence by Nafredi et al. This study showed that definitely when patients are more educated about their medications, they're more educated about their health conditions, they are more compliant, more active in their care, and are more adherent to their medications. These are just a few of the studies that I reviewed, and basically overall, there is a positive correlation with medication, education, and adherence. Here is another slide that just shows the impact of this problem. Just looking at the numbers here, we see that over 110,000 patients die annually because of complications that stem from medication non-adherence. This problem is beyond me, and I think that with collaborating with nurses and educators and providers, we can really have an impact here. And this is something that we cannot afford to ignore, we cannot afford not to address. And an evidence-based project to address such a problem like this is right up our alley as nurses, and we can have direct impact in our patients' lives. So what can we do? What are our action steps that can address this problem? As stated before, healthcare is impacted on every level by medication non-adherence. We talked about so far the complications that can occur leading to death and how we as nurses can directly impact. But how? So addressing two of the contributing factors that we spoke of earlier, healthcare literacy and lack of resources and education tools, we can definitely be impactful tailoring our interventions to address this issue. Medication education currently only typically occurs during discharge. So you go around, you take care of your patients all week, and then the doctor says it's time to go. You print out their medication, their discharge instructions, and you sit down with them for just a few minutes and just review all of their instructions about the procedures they had, the treatments they had, any follow-up appointments that they will have coming up. And then you briefly and very quickly review the medication list that they are now going home with. Some of those meds are meds that they have been on already, and some of those meds are brand spanking new that they have been taken just over the past couple of days. Maybe they weren't feeling well or paying attention, and they really do not know. This is an opportunity for change for us, and if we simply just take that time and go over these medications during their hospitalized stay and stress the importance of medication adherence, medication education, I really do believe that we can change this problem. Using the PCOT format, we learned this semester. My research question is as follows. In the hospital setting, will staff nurses who attend an educational session on the use of a standardized medication education tool report improved medication teaching on a post-educational survey than prior to the education? What a mouthful, I know. But basically, my project aims to find out if nurses can learn a different way, a standardized tool to teach their patients about their medications. Will that implementation of that tool impact their education that they are able to provide? Will they see a difference in their techniques that they use, in the compliance to teaching? Will they teach more frequently? And will it have an impact on adherence in the long run? Once my research topic was identified and my PCOT question completed, the next step would be to obtain approval to complete this project. I am no longer bedside. However, I do maintain contacts within the healthcare system that I am employed at. I have contacted the educator and the manager of the department that I intend to implement this project, and I have received their blessing to come and teach the nurses there using this tool and implement this project on their unit. I do still, however, need to reach out to the official approval board at the facility per their direction, just to make sure that everything is cleared and there are no concerns. Once this project is completed, I intend to share my findings in staff meetings, creating a poster, and also creating a newsletter that can be shared with the whole facility once everything is completed. The implementation of this proposed project would include using the standardized medication education tool in comparison to the how things were already done for teaching medication at discharge. So as we stated before, during discharge process, the patient would receive their discharge instructions, and that would be a thick packet that included other information such as about their treatment plan that they had already received, any follow-up care that they will need, and then finally a review of the medications. Using this tool, we hope to be more direct and more purposeful in teaching about medications and to share the importance of adherence and help patients understand their care more. This project I intend to use 4 nurses, 2 on day shift, 2 on nights. I intend to use a medical surgical floor as my population, and over the span of a month, giving time to teach the nurses to use the proposed tool and then to reevaluate at the end. Before implementing this tool, I intend to use the pre-test method to ask questions of the nurses to assess how they feel about medication education before this project, and then at the end use a post-test to reassess if this education tool was effective and if they feel that there has been changes to their techniques, to their consistency, and will there be changes to adherence in medication using this tool. Here is a sample of what an education card would look like. This is the medication education tool that I am proposed to using. And if you can see here, I intend on having this prepared by the nurses to share with the patient. It would have the name of the medication on here, what the medication is for. I intend to use a supplemental tool such as clinical documents that is more detailed, that the patient can have a copy of it, and their purpose of the medication, their doses, and then a refill schedule that they need to adhere to, and then just a quick reminder. There's little tips and tricks here. Take on a full stomach, ask your pharmacy for a 90-day refill. Those will also enhance adherence as well. So this is just a sample of the card that would be used, and supplemental documents to be included with this to send home with the patients to refer to as needed. This is a sample of the pre-test, post-test questions that I intend on using. As you can see, we used the Likert scale in order to complete this pre-test, post-test questionnaire. First, we asked yes or no questions to eliminate any variances, and we also used the scale range of questions to kind of gauge where the participants' feelings are, 0 to 10. So, for example, the first question: do you complete medication education on each shift? A lot of those I know will say no, depending, because as we saw in the research so far, 50% of nurses complete patient education every shift. And then the other one, on a scale of 1 to 10, do you feel that patients understand their medications? This is more subjective and will give us a range of feelings on this thing. The post test will ask a different question. It has the fifth question. Do you feel the education session and the use of this tool was helpful in providing medication teaching and implementing patient education? And this again will address is yes or no. It does not leave any room for subjective data. It just gives us, was this tool effective for you, yes or no? For the evaluation and analysis of this project, I just intend to compare the answers from the pre-test to that of the post-test. Expected findings, of course, I hope that this implementation of this tool will be positively received, and it will be impactful, showing that nurses are more compliant with education and they feel that it is effective and will improve patient medication adherence. As stated before, the potential outcomes overall will just be to improve medication adherence, to improve the complications of non-adherence, such as readmissions and patient poor outcomes. And it will be a good bonding experience for the nurses to spend that extra time with their patients, learning about their medications, addressing any questions and concerns that they have. So I do feel that this can definitely be an impactful project. Once this project is complete, as I stated before, intend to share my findings all over. I intend to use the H3W meetings at my facility, which are monthly staff meetings, to present this project and present the findings. I intend to make a poster board to leave in the nursing staffing lounge, where nurses will have time at their leisure to come and review it, and also to create a newsletter that will be shared throughout the facility through their electronic sources. Some limitations that I have already encountered and foresee encountering will be the approval process. As I stated, it was a challenge to find the managers and reach out to them because I'm no longer bedside, so don't have face-to-face contact. So therefore, I was grateful to get their blessing. My next challenge will be to getting participants or volunteers to actually complete this project, and implementing the project in a timely manner will also be a challenge for us in the future. Overall, I do believe that this project has the potential to really change patients' lives. I do believe that the nurses have the power to make that type of change, and to just do something as simple as medication education can be really, really instrumental. And I really do believe in this project. Thank you for listening to my proposal. These are my references, articles that I referenced to get my evidence to support this topic. Thank you so much for your time. Thank you for listening, and I hope you all have a great day.